Hey, this is Dr. Chase Petersen from the Budge OBGYN clinic. This is our first of these live sessions today for me, and we're going to focus on having a kind of planning for a healthy pregnancy, trying to put all of the steps in place to have the healthiest pregnancy possible from the get-go. The way this session will be set up is I'm going to kind of go through some of the counseling that I may have if you came to see me in the clinic before pregnancy, and then at the end we'll be taking comments throughout the session, and then at the end we'll answer any of those questions as we're going through. So something that a lot of people do before they come and see me initially even, but that is an important aspect of being ready for pregnancy, is just kind of thinking about the various aspects in your life as they relate to pregnancy. So like emotional readiness, financial readiness, relationship issues, just making sure that you're in a great place to add like another aspect or facet to your life, and being prepared for that it's consistent with your goals and values there and it's planned. Other things that are important is family spacing when people are considering pregnancy. So ideal family spacing has been found to be between like 18 months to 24 months, but really any time from 18 months to about 5 years is considered good family spacing. Once you get shorter than 18 months, you start running into increased risk factors, particularly less than 6 months from the delivery of your last child. Conceiving within that time frame can increase your risk of preterm birth by 4-fold, as well as a lot of other early complications in pregnancy, such as early rupture of membranes, having a small baby, separation of the placenta, or even issues such as autism or schizophrenia. So it's important to give your body time to recover after your last delivery. A lot of that's nutrient depletion, and giving your uterus time to completely heal. Interestingly, a really long time between pregnancies also isn't ideal, so greater than 5 years puts you in a category where you start kind of going back to, if you've had children in the past, where you may have a similar experience with delivering your first baby with your second, instead of giving some of that benefit of having a second child a little bit closer to the first, where things go easier. One of the last things evaluating just your readiness for this is what birth control method you're using at that time. So things such as Depo-Provera shots that you get every 3 months are not ideal to be on if you're considering pregnancy, especially within the next year. Those can have some latency or time between when you stop the Depo-Provera shot and when you're likely to be able to conceive. There's perhaps a small amount of that with birth control pills, but not reliably so, and so I wouldn't recommend stopping your birth control pill significantly in advance of when you'd be interested in conceiving, without using a backup method in the meantime, such as condoms. Then kind of moving on to evaluating your general health and optimizing any health conditions that you have. That's a really big part of preparing for pregnancy. So like your health and lifestyle. Substance abuse is an important thing to work on before conceiving. Things like tobacco smoking increase a lot of risks during pregnancy and even as your child is a newborn, such as sudden infant death syndrome or SIDS, asthma, colic, even childhood obesity, as well as the baby being small. Alcohol consumption is, along with uncontrolled diabetes, is one of the highest causes of birth defects in the United States, even considering medications and various other exposures. And so really ensuring no alcohol consumption during pregnancy. The American College of Obstetricians and Gynecologists says that even moderate alcohol consumption can lead to emotional and behavioral problems for the child longer term, and high alcohol consumption can lead to intellectual disability and facial deformities. So these are all really important things to kind of be aware of and plan for in your pregnancy, so that you can avoid some of these risk factors that could be modified. There's a lot of states locally, such as in Colorado, where marijuana has been legalized, and so this question has come up also a lot as well, the safety of marijuana in pregnancy, and there have not been any long-term or large studies to confirm safety or even to give us a clear idea of what the risk profile is with marijuana in pregnancy, so that is also not recommended, as well as any recreational drugs, of course. So next, moving on, is weight is an important part of approaching pregnancy, and the goal is to really achieve a near normal BMI, or body mass index, which is 25, between 18.5 and 25 before conceiving. This does a few things. It increases your likelihood of conception, which is very important and valuable, and also it can reduce your risk of birth defects and various complications such as preeclampsia, high blood pressure disorders in pregnancy, gestational diabetes, preterm birth, C-section, and blood clots. So in the time that you have before conceiving, really work on nutrition, exercise, and focusing on becoming the healthiest that you can be before you initiate pregnancy. Specifically with exercise, it's recommended to exercise most, if not every day of the week, 30 minutes a day. Cardiovascular exercise as well as weightlifting, all of those things are great. Not only does this prepare your body physically for the strains of pregnancy, but also you're more likely to be able to continue this throughout pregnancy, which I strongly endorse exercise throughout the course of pregnancy. And we'll kind of talk about considerations once you are pregnant in future visits or live sessions, but that's kind of a very important aspect. It's good for your mental health to kind of be coming from a good place before you become pregnant, since there are a lot of stressors that develop throughout pregnancy, and it's great to be coming from a position of strength. As far as nutrition goes, if you adhere to a very strict diet or a very kind of poor diet, it's important to consider improving those factors before pregnancy as well. So folks who may be on a strict diet due to diabetes, irritable bowel disease, or they're vegan, there's the potential for nutrition deficiencies in that, and so you want to be aware of the nutritional deficiencies that you may be more susceptible to due to your dietary restrictions, and compensate for that with various supplements. And you'd want to see a healthcare provider about that to give you better information. Folks who've had weight loss surgery in the past have risk of malabsorption, as well as illnesses like cystic fibrosis and things like that. Next is to know what your immunization status is. So whether you're immune to chickenpox, rubella, such as in the MMR vaccine, as well as other common vaccines like hepatitis A and B, the influenza vaccine, or even the HPV vaccine, human papillomavirus, that helps reduce your risk of cervical cancer. Well, a lot of these aren't necessarily specific to pregnancy, such as the HPV vaccine. It's just a great time to consider your health generally and to optimize that. If you have never had chickenpox or been vaccinated, it's very important to do that beforehand, because being exposed to shingles or chickenpox during pregnancy, as well as rubella, can significantly affect the health of your unborn child. And so you can even have your titers checked to see if you developed adequate immunity to those things, and be vaccinated before pregnancy. Ideally, you do that at least a month before conceiving, but up to 3 months is ideal. And then consider other infectious and environmental exposures, such as things like Zika virus is very big in the media now, and we can post some resources to our website from the CDC about this. But things to consider is timing of conception and vacations and things like that around there. So what we know is that for women who've been exposed to Zika virus, which is a mosquito-borne virus that's present in Central South America, Africa, quite a few Caribbean islands and other places like that, only about 20% of people have symptoms, and they're pretty mild when you have them, such as rash, fever, red eyes, different things like that. That you'd want to wait 2 months before conceiving, after you'd been exposed as the female. And if your male partner had been exposed, we have them wait 6 months before conceiving or having unprotected intercourse, since even though this is a mosquito illness, you can actually pass this on sexually, male to female, for up to 6 months afterward. So that can really affect people's timing with deciding when to get pregnant, vacations around that time. Other exposures, such as like CMV, if you work in daycare or have small children, that can affect your pregnancy. Toxins at work, or maybe environmental exposures like lead, are all things to be considered. You can talk to your healthcare provider about that. So other things to just screen and optimize your health before pregnancy. You know, having adequate screening for sexually transmitted infections if you've been exposed or concerned about that. Also knowing your prior surgical history and planning what surgeries you may be planning to do going forward. So if you have an elective surgery you've been thinking about, definitely avoiding those during the first trimester when you could be very early pregnant is important, since those anesthetics that they use could be damaging to an early pregnancy. You'd want to avoid that. Other things that are important, like dental hygiene, so brushing twice a day, flossing, seeing a dentist for cleanings regularly. Dental hygiene can lead to, of course, cavities and abscesses in your teeth that can lead to preterm birth. So it's important to have that all in check before pregnancy as well. And then just like a lot of common health conditions such as high blood pressure, diabetes, thyroid problems, anxiety, depression, ADHD. A lot of these have medications that go along with them, and you'd want to optimize these conditions beforehand. You'd want to see a healthcare provider so that they can make sure that you're on a medication regimen that is safe and appropriate once you become pregnant. Specifically about diabetes, you'd want to have your hemoglobin A1C under 6 before then to reduce the risk of miscarriage and of birth defects associated with diabetes, like we kind of talked about before.
We've got a couple questions. You want to take a break and
sure, yeah.
Go through them? Okay, awesome. The first one is Samantha's with us, and she just would like to know how long you would recommend waiting in between getting pregnant. I think you mentioned that a little bit at the beginning. Mm-hmm. Anywhere between 18 to 24 months is the ideal time to let your body recover.
Yeah, so at least 18 months, somewhere between 18 months and 5 years.
Is the best time. Mm-hmm. Perfect. Erin's wondering, does weight loss really help prevent preeclampsia, even if you've had it twice before?
So there are a few interventions that can be done to try and reduce your risk of preeclampsia, such as taking a low-dose aspirin, especially if you've had it twice before, is something that they'd recommend, beginning at about 12 weeks, between from about 12 to 28 weeks during your pregnancy. But weight loss between can improve that, because it can improve a lot of other health factors, such as your predisposition to hypertension or high blood pressure. And so certainly it is helpful and can reduce your risk of preeclampsia in the future.
We'll do one more. Alexandra's wondering, how long do you recommend waiting to get pregnant again after a miscarriage?
That is a great question. So this has been looked into quite a bit before, and there were some studies that recommended waiting a longer time, like 6 months, and then quite a few other studies looked at other factors associated with this, and that's sort of been debunked for the time being. And so really, as soon as you're ready after a prior miscarriage, this is a miscarriage like in the first or very early second trimester. Mostly first trimester miscarriages, though, fall into this category, where after you've had a normal period, after that miscarriage, you can go ahead and get pregnant again. It's important to follow up. They'll usually have you check a beta HCG hormone level after your miscarriage to make sure that that's gone back down to 0. You don't have any residual placental tissue or pregnancy hormone around before you get pregnant. But yeah, you can get pregnant again right away. In fact, some studies show a slight increased fertility rates after a prior miscarriage. So we'll kind of go back to just a few more things to think about. We talked about a lot of those really common health conditions, specifically things like anxiety, depression, ADHD. A lot of people have concerns about these medications before they get pregnant. And while I can't give a full list of what everyone would want to do, because everyone is an individual and we have to really approach medication choices from an individual standpoint, avoiding a medication class called benzodiazepines, which is things like Xanax, Ativan, Klonopin, Valium. Those are the brand names of those medications. Those ones are category D in pregnancy, have increased risk of cleft lip and palate, as well as withdrawal afterward. And we really try and avoid those ones whenever possible during pregnancy. Certain antipsychotic medications, depending on the situation, we would avoid. Adderall is another one that you'd talk closely with your doctor about, and you'd weigh risks and benefits, just like we would with antidepressants such as Zoloft or Celexa. Those are not deal breakers and not things that you would want to just immediately stop when you found out you were pregnant. It would be much better to have a conversation before pregnancy with the healthcare provider to make a plan for how best to approach this. When I get pregnant, what should I do? If I'm considering stopping my antidepressants, how is the best way to taper off of that to improve my likelihood of success and of remission of my depression. So those are great things to really have a good conversation with your doctor about. And then looking at other very serious health conditions that some people may have, such as, you know, heart disease, kidney disease, liver or metabolism disorders like PKU, digestive issues, significant asthma or other respiratory problems, bleeding or clotting disorders, seizures, or infectious issues such as HIV, hepatitis, or autoimmune problems like lupus or rheumatoid arthritis. This is just a list of things that we still see quite a bit in our patients who are pregnant, and ideally we would see those patients before they become pregnant so that we can talk specifically about the risks and considerations with getting pregnant, whether that's something that are risks that they're willing to take, and how we can reduce those risks for them and their potential baby as much as possible beforehand. Then kind of moving on to just knowing your family history is really important when you talk to your doctor. So if you have somebody who has cystic fibrosis, something called Tay-Sachs, sickle cell anemia, thalassemias, their muscular dystrophy or like mental delay or mental retardation, these are important things to be able to talk to your doctor about so that you can decide whether there are any risk factors you'd want to screen for before pregnancy or watch for closely during your pregnancy itself. And then there are certain medications that you should just never be on during pregnancy, things like warfarin, lithium, certain seizure medications or antipsychotics. So there's a few, you know, medications that you just would not want to be on at any point during your pregnancy, and you'd want to make a plan beforehand of how to adjust for that. And then the last part is just like thinking about going forward. So like really knowing your cycle, knowing when you're ovulating during your cycle is great. There's lots of free apps out there that tell you when your fertile time frame is, and intercourse every other day during that time frame is more than enough to get pregnant. That's about how long it takes to build up a full amount of sperm to be able to optimize conception anyway. Other things that are valuable is really just not stressing about it. That 80% of people will conceive within the first year of trying, and even 90% within the first 2 years. So not letting this weigh heavily on you as you're approaching pregnancy, that's probably the healthiest and best advice I could give you, is just to kind of take things in stride, take things as they come. And if you have questions, certainly see your doctor or midwife about that. Last thing is like prenatal vitamins and like specific nutrients in pregnancy. A lot of people have questions about this. What prenatal vitamins should I be taking? When should I start them? At least a month before getting pregnant, try and start taking your prenatals, but up to 3 months is ideal. Folic acid is one of the most important components to a prenatal vitamin before you get pregnancy, and that's why you need to take it for so long beforehand, is because it takes a while to build up in your body. So 400 micrograms is the minimum amount that you would want to take before getting pregnant, but the doses range significantly in prenatal vitamins from 400 micrograms to a milligram or 1,000 micrograms. And that's very reasonable, except for very young women, like between age 14 and 18, they'd want a little bit less folic acid than the 1,000. Other specific nutrients and those doses in pregnancy, instead of going through those all together right now, you know, those things are like calcium, iodine, vitamins D, A, and B12, and iron. I'll put something up on, post it to Facebook so that you can kind of look at those recommendations during pregnancy based on your age and where you're at in pregnancy. It also will have lactation levels, which is kind of nice to make sure that you're getting adequate nutrition during that time frame. And so the last things to consider before pregnancy is avoiding fevers when you're early pregnant. You may not have seen a provider yet for that, but that's actually a very dangerous exposure for developing fetus as well. So you want to treat that down with Tylenol. If you get any fevers, avoid hot tubs, saunas, all those sorts of things, particularly in the first trimester. And then just give us a call when you're pregnant. We will be delighted to take care of you and to see you and answer all these questions. Ideally, we'd see you beforehand in case you have any of these questions to discuss, but particularly once you have a positive pregnancy test, just give us a call and we'll set you up for a new visit. And most of all, don't forget to call us if you're nauseated. Don't be sick for 2 months before you come and see us for your neuro week visit. We can help out with that stuff.
Perfect. Lauren says that they miss you in Madison.
Oh, that's wonderful. Thank you. I miss you guys as well.
So with the prenatal vitamins, a lot of people end up getting sick when they take the prenatals, right?
Mm-hmm.
So is it recommended that if it's making the throwing up worse, do they need to continue to take that, or are there other options to help?
So there are other options. You can kind of break up those vitamins a little bit in case there's a specific component that's bothering you. So one thing that I've heard from more than one patient about is taking more than one of just a regular multivitamin instead of their prenatal, since they feel like the prenatal makes them sicker. Please do not do that. There is toxicity that can come with excess of a lot of these soluble vitamins like vitamin A, D, E, and K that can actually cause birth defects of their own if you take excess amounts. So never take more than one of a regular vitamin, but you could potentially break up those vitamins. So some people, or take them in a different form. Like gummy vitamins sometimes are better tolerated by some people, and there are prenatal gummy vitamins out there. You could take if you can tolerate a regular multivitamin really well, but you're still early in pregnancy, we want that folic acid to stay high, you could take a separate folic acid supplement to get that multivitamin to the appropriate level. Taking the prenatals at night and with food are also great strategies to be able to tolerate those better.
Riley's asked a question. She said, what about tips on irregular cycles and knowing when she's ovulating? Is it harder to conceive with an irregular cycle? And I guess to go along with this question, the ovulation kits that you can buy over the counter, how accurate are those?
They're reasonably accurate. There can be some false positive and negative rates on that. And if you have irregular cycles, that presents an additional challenge because you may not be able to easily track down when that specific time for you would be, especially if your cycles are just all over the place, whether it's 15 and then 30 days, 35, 45 days. And so it is something that you can definitely try. Just a brief kind of information about those cycles. I believe Dr. Craig kind of made a little bit of a video about this as well, but the time from when you ovulate to when you have your next period is 14 days, and that's a pretty strict time frame, and that's what all those apps base their information off of. The first half of that cycle, from when you had your last period, the first day of your last period, to when you ovulate is variable. And so you kind of have to count back from when you expect your next period to be to know when you will ovulate. Those apps do that kind of in a predictive way, just counting backwards from when your next anticipated period is. And you can use ovulation predictor kits to try and see where you're at with that. But if you're really struggling, you're not getting any positives, and you're feeling frustrated, please come and see a physician about that, and we can work with you on your own specific issues, because there may be things we might want to look into. There are a lot of common things that can cause people not to ovulate regularly, but we'll talk about that in detail.
One last question. Lisa's wondering, with your second baby, some people get started at 39 weeks. Would you recommend waiting until your body says you are ready, or being induced at 39 weeks?
I think that depends somewhat on your desired experience. There isn't, especially with a favorable cervix, there isn't a significant downside to being induced at 39 weeks. It depends on where you are. When I was living in Wisconsin, it was much less common for people to be induced electively at 39 weeks, just kind of the culture of the area at the time. It's much more common here in Cache Valley, and that's all great and kind of just regional variations on that. Things that weigh into whether you would want to be induced: if you plan to have an unmedicated and very low intervention childbirth, which we are really supportive of, you may be less interested in trying to be induced, just since that necessitates at least some interventions, though maybe small, such as some low-dose Petersen or breaking your water to try and get things going. So if you want to be able to just kind of come in and be able to labor in a way that is very unique to you, then it is a little bit better to be able to come in and labor on your own, just because you kind of get started with that process at home. The initial part of that process takes place in your own home, where you're perhaps more comfortable, and then you can come to the hospital once you feel like you're changing. And so that's the short answer, I guess, or medium length answer on that.
Thank you, Dr. Petersen, for doing this video with us. I think we're going to keep doing these.
Yeah.
We have a few other topics that we'll probably hit. I know Dr. Craig had said postpartum depression, and some others that you may feel.
We'll definitely talk about, you know, how to have a healthy pregnancy once you are pregnant. You know, focus on things like exercise, nutrition, and various other like common issues and complaints during pregnancy. So please tune back in, and we'll do these again in the future. And thanks for watching today. This is helpful.